honor and pleasure to be here. Thanks, Ben. Thanks, Ariel. Thanks, Dr. Snyder. I think I'm towards the end of the day, so I'm going to try and give a bit of an overview talk about a bit of the art of the possible, of what's happening in health medicine and how that applies to the future of mental health, sort of the theme of the day. And I was feeling a little inspired to do some art this morning about the future of Stanford or future of mental health. And of course, I'm a terrible artist. I had a little help. We've all been playing with DALL-E 3 to make our new art, or we're now at GPT-4, soon GPT-5, and who knows what else is going to come next. It's been a bit of a Gutenberg moment, right, in terms of it's only launched, I think a year ago, tomorrow, November 30th, was GPT-3 launched. And it's been quite transformative, including, of course, in healthcare, and it's going to, I think, an example of an emerging technology that's really going to make health hopefully more intelligent, more connected, more data-driven, more democratized, and accessible around the planet. And take us to where we sort of broadly are across mental health and regular health, from where we are in sort of a more sick care world based on intermittent reactive data to a future that's more continuous, proactive, and personalized for all of us. And so, of course, a lot of these changes are coming faster than we might anticipate, sometimes faster than regulatory reimbursement, ethics, and society is ready for. And we've sort of seen that already with ChatGPT. It's already making diagnoses that are missed by many specialists. It's where I train at Boston Children's and Mass General. They're hiring prompt engineers. Physicians are cheating on it to do a better bedside manner with their patients. And of course, it's not perfect yet, but wait a couple more clicks of Moore's Law, and it's going to be even more incredible. And I think while there's some sort of low-hanging fruit for generative AI, scheduling, some basic elements, if you were to look a bit further into the future, I don't know if I made up the term generative health or sort of generative mental health. You can imagine each of us will have health bubble journey, mental health coach, personal psychiatrist, et cetera, that integrates all our data and bases it on our individual age, culture, language, incentives, history, et cetera, to really tune our whole healthcare continuum. So, of course, health is wealth, and the future of health and medicine is being driven by a lot of often accelerating technologies. I gave a TED Talk back in 2011. The future of medicine is an app for that. At the time, there were only about 20,000 apps. Now there's well over 300,000. But the theme of that, and I think that even the future of mental health, is that it's at a super convergence of technologies getting faster, better, cheaper, more available, and sometimes more magical, and are creating entirely new fields. And I was a Stanford medical student 20-something years ago. We didn't have computational biology and designer antibodies and robotic surgery and digital therapeutics and CRISPR and virtual reality. These are all our new tools to rethink and reimagine healthcare, mental health across the continuum, not just what's available today, but what's coming next in the next few years. Including health span and longevity. I think we all want to live longer quality lives, not just more years in general. And so it's a really interesting time to think about the art of the possible. Of course, technology plays a role, but we know, of course, social determinants are even more important to our health span and brain span and mental health. We have some sort of core Maslow hierarchy elements that we need to pay attention to: physiologic needs, mental health needs. But of course, in our digital age, and you think about the digital determinants of health, of course, battery life is at the base for most of us. But we are in the future. It's 2023 already, almost 2024. But sometimes it feels like we're a bit back to the future. When you go to a clinic around here, or when I was back visiting Mass General, where I trained a few months ago, we're still using fax machines. We're still often filling out the same paper forms. I had a cardiac study done at Stanford about a year ago. I got my results on a CD-ROM. I don't even own a CD-ROM player anymore. So some of the architecture of our whole healthcare paradigm is based on old rails. And of course, the way we share, of course, we don't really practice precision medicine. For the top 10 grossing drugs sold in the US in the last few years, they're really only effective for 1 in 4 to 1 in 24 of the patients who take them, including very common mental health drugs like Abilify. So we have a long way to go to getting to precision medicine and to getting out of our old rubrics and silos of how we sort of don't integrate health information and new knowledge. So huge opportunities to innovate into this new health age. And speaking of new health age, we've seen a lot of fields get completely disrupted, how we do our digital banking and digital movies. Of course, we've had COVID disrupt all of our lives for the last 3+ years, and that was a bit of a catalyst. If we're to look at some of the positive elements of it, I think of Sputnik set off the space age, but COVID had sparked a bit of a new health age, and many of us in the room innovated differently, collaborated in new ways. Hopefully we can take some of the energy forward into mental health and beyond. So I actually gave a talk 2 years ago, another TED Talk, how COVID-19 has transformed the future of health and medicine, from virtual trials to mRNA vaccines, et cetera, which I think gives a bit of framing for this talk as well. Where were we a decade ago in that other TED Talk? Where are we last year? Where might we be going next in the decade ahead? Because This famous quote kind of summarizes it. Most people overestimate what they can do in 1 year and underestimate what they can do in the next decade. So what might your vision and view be for mental health in 2033? Because it'll be here before you know it. So I've been a bit of an accidental futurist. I'm trained in internal medicine, pediatrics, did my fellowships at Stanford in hemonc and bone marrow transplant, but had an interesting journey sharing medicine for Singularity University and neuroscience there as well. Founded a program called Exponential Medicine, now called NextMed Health, which thematically brings people out of their silos to look at this convergence of what's on the cutting edge and what's coming next and how do we bring that future faster. We've had some famous Stanford faculty there at our NextMed Health last March. Also lucky to have Aloe Black there. It was so great to see him again. And one interesting experiment we did there with Aloe is, and we've had examples of music as medicine and improving our mental health. We did a little experiment. We leveraged this app called Bina AI that can do your vital signs on your mobile phone from your finger or the camera. And we asked what were people, we had everybody in the room crowdsource their data from their phones. Before and after Aloe played, you could see average heart rate went down, heart rate variability went up, wellness scores went up, average blood pressure went down. Just the example of real-time quantified self in a crowd. It was an interesting experiment we had there. But one of the takeaways from, I think, this sort of gathering or NextMed Health is that this quote from shared by the head of NHS Innovation: the difficulty lies not in the new ideas, but in escaping from the old ones. And a lot of folks in the mental health profession are stuck in old ways of doing things, paper forms, et cetera. So here in this room, we need to bring others up into this new way of thinking. So let's look at a few things that were a decade ago, where they are now, and they are next. One of those is genomics, something that's obviously moving pretty quickly. We're roughly at the $100 genome today. Soon, in a decade, it'll be $10. We could leverage this today in ways that are possible but aren't often utilized. I need more than that. I think I have 15 minutes, right? Not 10. So time check. So pharmacogenetics, of course, is one way we could be leveraging that sort of data. Genomics England is a great example of starting to connect the dots between genomic information in the clinic so we can have a learning engine. As Stanford has already demonstrated, you can sequence a whole genome in less than 5 hours. That'll sort of be kind of the norm in a decade. And I think we'll almost understand every disease at its genetic level. It could be autism, it could be any form of mental health, like we can now understand diseases that are common like diabetes and subset them at their genomic realm. And of course, picking the right medications when you need them for certain mental health disorders can be much more tuned, leveraging the sort of emergent realm of the digital twin. This idea now we can take all these new omics elements from microbiome, genome, metabolome, exposome, and integrate them together and start to hopefully make sense of them for the individual so that each of us and our patients can be sort of simulated and leveraged so we can optimize prevention and wellness, diagnostics, and therapy. And of course, Stanford spin-outs like HeartFlow or digital twins of the heart. I think we'll see whole examples of digital twins for mental health and neuroscience and beyond. So of course, a lot of this technology is moving quickly. You need to think exponentially. Moore's law, the power in computing and our mobile devices and wearables is moving very quickly. A lot of old school technologies, of course, have been digitized and dissolved and democratized and sometimes even demonetized. Quantum computing is coming quickly to play a role, I think, across healthcare. But if we look at our favorite exponential technology, the smartphone, it already has a lot of opportunity across normal health and medicine and mental health. We're already, dissolving our next generation phones into our Apple Visions and beyond, or contact lenses in the next decade that will probably port our information directly to our eyes. That's bringing us this new world of often called augmented, virtual, or extended reality. It can bring very complex information into the clinical environment. It can help clinicians be guided step by step through procedures, whether it's a surgical procedure or otherwise. Augmented reality can be used to educate each of us and our patients to learn about our anatomy, our mental health, et cetera. When you can sort of see yourself or in your body, that can be a big leverage point. So you can see not just you of today, but you of tomorrow if you're doing a workout and your P90X and your meditation, or if you're just having Dunkin' Donuts and sitting on the couch all day. That can be a lever for change, or before 100 Dunkin' Donuts and after. Those are leveraging realms of what's next. Or if you have a patient who smokes and you want to show them before smoking and after smoking, that can be a new tool to change behavior and mental health and other outcomes. Or too much time on social media. Then, of course, and my friend who was visiting earlier, Hazard Lee, is a F-35 pilot, so I thought I'd flow in some aviation since I'm a pilot and was served for 13 years in the Air National Guard in California, is the world we use of augmented reality in the fighter cockpit. And that's a realm where we now can bring information outside of the old traditional round dials to give you insights. Who's shooting at you? Where's the bad guy? Or the plane can talk to you if you're about to hit a mountain, right? That's a clue to change your trajectory. So how will we think about that in the future, behavior change in mental health? We might see our breakfast in one way, and now with our augmented reality contact lenses, see it in another way and get a little nudge before we dive in, right? So that'll be part of our integration of behavioral modification. And then, of course, back to the old cockpit. I started flying in an old 1970s Cessna, the old analog dials, the paper maps. I can't imagine flying that way. The plane I have now is a little two-seater, but has a complete glass cockpit, touchscreen GPS. So you can imagine for the mental health worker, for the patient, we'll start to enter this world of real-time situational awareness with real-time information about weather and where the traffic is, and integrating sort of this new world integrated into our augmented reality dashboards for every element of healthcare. And then, of course, there's virtual reality. It's mentioned a bit earlier. It's fun to put grandma on a roller coaster. It feels real. Or to put someone, as was mentioned, on the plank. It's really compelling. But what's powerful there is it's this new modality. Of course, it can be used to treat pain in very powerful ways. You go in through snowballs and penguins, and it changes the patterning in your brain, and folks use less than half the opiates, so there's really good data on the pain side. VR is being used in physical therapy. It gamifies folks to do things that can impact mental health. For folks who are stressed out in inpatient or outpatient settings, they can go to the virtual beach, and that can lower needs for anxiolytics and reduce hospital stays. And then, of course, a whole bunch of applications in now workouts. I spent 100 days working out in Supernatural early in the pandemic. There's other examples like XR Workout, where you now with blended reality can do things that might feel difficult, but now in these augmented blended reality modes really get folks motivated, and that impacts mental health. And then on the full-on mental health with VR, there are lots of applications from treating phobias in VR to platforms like Trip, sort of guided meditation, psychedelics in the VR headset, all the way to other applications that are trying to blend together. The trick is getting mental health workers to prescribe things. Pear famously failed because it was a great application, but not prescribed as needed. I have a new seed stage venture fund. We're seed investing some folks, including in mental health. One example is Deepwell. It's a combination of a medical device co-founder and a video game original gangster. They've combined together to create now video games for mental health at scale, both to evaluate your mental health and up-level this when folks are playing individually or at scale. So watch that space. Medicinal media is the term. And even VR is going up to help mental health on the space station in the next year or so. I think a lot of possibilities there. And of course, VR in the educational space, which many of we are in, is a big game changer for learning your cardiac anatomy. This is a Stanford project called Virtual Heart, all the way to simulation. Instead of see one, do one, teach one, to simulate. And it could be a clinical encounter with a mental health patient or a surgical one. The bottom line is it's going to enable us to train differently, to get real-time information crowdsourced from thousands of cases and procedures, and to up-level all of us, just like we have driver assist coming into our cars, to full autonomy, to upskill almost anybody to do what it took 10,000 hours of training. Okay, switching to diagnostics, something key in mental health, of course. We have all these new tools on our phones. A decade ago, we could do the first versions of blood sugar on a smartphone. We had the early versions of EKGs. Now they're sold on Amazon, on CNN. You'll see ads to get your own 6-lead EKG that now fits on a credit card case. Other examples of integrating wearables, and we talked about this earlier this morning, is coming to your wrist. Now I've got a version on my wrist now that does real-time blood pressure. I've got another prototype that does blood pressure and blood sugar. Not, of course, FDA cleared yet, but I think the Apple Watches 2 versions from now might have real-time blood sugar, blood pressure, and much more that'll integrate into mental health and physiology. And of course, you don't need to wear anything. As I showed earlier, the camera now can pick up vital signs. That's going to be a game changer to give continuous information. The camera in your smartphone also can be a diagnostic platform. Urinalysis now can be done at home. You just dip your urine, and using the AI-empowered camera, you get your immediate result, and that can save a visit to the lab or predict sepsis or preeclampsia, et cetera. Easy peasy. So this sort of lab on your phone, this idea of the medical selfie. You can look at ear infections through your phone. Voice, the microphone on our devices now can be hugely predictive, from early signs of neurologic disease, heart disease, lung infections, is that cough, COVID. The sound of your voice can predict blood sugar, as published last month. That might be picking up and screening for diabetes. And of course, a ton of information now for voice as a digital marker for anxiety and depression from companies like Canary, one called Sond Health, another one, Kintsugi, are all in the market now trying to measure in real time, mental health, again, as a biomarker using voice. So watch that space if you haven't looked at it. Then, of course, there's the ability to look at all these tools to measure our behaviors, which drive most of our downstream outcomes. The first Fitbit only launched in 2009. That wasn't that long ago. Now we're all have a gazillion wearables on us. I've got a bunch, as do many of you. And now they can measure almost every element of physiology and behavior, right? They're starting at the consumer side, but they often are moving to medical. And a few fun examples that are out now are these, biointelligence patches. They're basically the equivalent of a ICU level data streaming from a disposable patch. Patchables that powered by body movement that can have an ultrasound built in. Earables that don't just play music, but can track all sorts of other physiology. Wearable EEGs like Muse, which can be used to coach meditation and other elements. Ingestibles to track the health of your gut. Lots of things are coming in the wearable space, even sweatables. So, when you think about wearables, don't just think about the wrist. Even underwearables is a spin out from Spire, a spin out from Stanford, started as an anxiety and depression app, measuring breathing rates, and is now with new incentive codes, follow the incentives, with new CPT codes that are being leveraged in remote patient monitoring for respiratory distress. So a lot of these consumer devices are moving to the true medical side. And of course, think platforms like the Oura Ring, which are good at tracking sleep, are getting more and more sophisticated. They can predict pregnancy 5 days before a home pregnancy test. They can predict anxiety and depression. And so all these sort of consumer tools at scale can start to give us early proactive warning. So you don't need fancy data. It can be a simple wearable like a Fitbit. Someone goes home from a mental health admission or a total knee replacement. Are they walking more as expected or walking less? And we can use that small data to intervene early with the folks who are not going on the expected trajectory. And then, of course, as already been mentioned today, food is medicine. Really interesting to learn about the metabolic health in the brain. We're entering an era now, of course, we can quantify our meals and analyze them with our smartphones, what our inputs are and what our outputs are. The whole world is coming to our ins and outs are coming to our home environment. I think combined with metabolomics for CGMs, we'll enter this true era of precision nutrition, which, as we heard earlier, can really impact mental health in really powerful ways. So watch that space. So a decade from now or sooner, we'll be in this era of, our digitome being collected 24/7. We have a lot of privacy issues to get through. You won't need to be wearing anything to collect that data. Who owns that data? How do we integrate that with imaging data? Of course, now your brain can be imaged and come color-coded with AI labeling. Last year at this conference, we heard from Leanne Williams, all the new work with imaging and precision psychiatry. And I think in the next decade, we'll go from, the full body MRI in an hour to be able to go to your corner pharmacy and get a full body scan in 10 minutes read by the AI radiologist. So really interesting implications for imaging. And some of those imaging devices are becoming wearable, like Open Water, that can detect brain issues from stroke to brain masses and beyond. So imaging, diagnostics is getting super interesting. And that means all this can now fit in your pocket. You can bring mental health or a clinic in your pocket almost anywhere on the planet. That can be useful for a clinician or a community health worker. Stethoscopes now are powered with AI, so I don't need to be a good cardiologist. I can do the murmur analysis there or have the portable ultrasound in my pocket. All these things are, in big picture, democratizing diagnostics anywhere on the planet. That goes for mental health as well. Mentioned earlier, I've been sharing the XPRIZE health division. We ran a whole bunch of elements and prizes, including during the pandemic, for better diagnostics. Of course, diagnostics for COVID were important. We just had a whole XPRIZE visioneering element. One of the finalist prizes was one related to mental health. The whole loneliness epidemic is certainly not news, but how might we leverage prize models to think about new ways to address the massive loneliness pandemic and all its mental health applications? So if you're interested in helping develop XPRIZes in mental health, come find me. All right. Finally, of course, we need to pull all these new forms of information together. AI is, I like more to frame it as IA, intelligence augmentation. It's moving quickly, from the MedPalms at Google to everyone else building LLMs to the GI folks using it to find lesions that might have been missed and to the back of the eyeball, as mentioned earlier. I think big picture-wise, we're going to start to use AI as a bit of a co-pilot in our care to find and predict mental health problems before we get them, reduce medical errors. And we'll mention earlier the Minority Report. A decade from now, we're going to sort of get that tweet or that message or that nudge that tells us that disease is at stage 0 when we can intervene early rather than late. And of course, these technologies need to be collaborative, not competitive. There's always the concern about, is the AI going to take your job or the robot? Because these are increasingly getting blended with robots with soon to be AGI. Lots of opportunities there at the interface. Of course, it's going to be more of a collaboration than a competition. And again, it gives in the shortage of many mental health workers, psychiatrists, and beyond, can really open up opportunities and unmet needs in many parts of rural America to the rest of the planet. And of course, all this integrates in this new field of digital health or mobile health or connected health. I like to think of digital health and digital mental health as the ability to take all these new forms of data and make sense of them. Sometimes it's through an app, sometimes it's through another platform. But to integrate that in smart ways. And of course, now we're in the era of not just prescribing a drug or a device, but an app. There are digital therapeutics to help you quit your smoking, or prescription video games that can treat ADHD better than Ritalin, or platforms like Marrow Health for ADHD, for anxiety, depression, and PTSD, or on the far end, We Therapeutics doing digital therapeutics for suicide prevention. So really interesting apps in that space to track. And what that enables now is this shift from quantified self. A lot of us are data geeks and keep the data on our phones, to move to quantified health, where that data is going to flow to our clinicians, our mental health workers, our virtual coaches, and enable optimized wellness, diagnostics, and therapy. And we're learning now to crowdsource that. Platforms like All of Us or the baseline trial from Verily are going to blend us into this era in the next decade of true predictive analytics, a bit of a FICO score for each of us, from our blending not just our vitals in our labs, but our mental health, our psychological scores, our social connection scores, our financial health, integrating that into useful collaborative ways, and lead to that, again, stage zero medicine, the idea we'll each have a bit of a check engine light for our bodies, integrating all that information at scale. And I love that Mike's been such a leader in this and was doing check engine lights many years ago, and inspired a lot of that opportunity. So again, the challenge now, and we've heard a lot about innovations here today, how do we take the innovations that are already out there and make them useful? I thought that as a bit of a challenge, so a year ago launched a platform called digital.health. That's the website. If you go to digital.health, you can now find a digital health formulary, including a lot of things that relate to mental health. Just an example, if you're searching for diagnostics around cardiac, you can find things like the AliveCore and put it in your own digital health formulary and prescribe that to a patient. Or you're looking at common issues like diabetes. You might want to look for therapeutics that relate to diet and nutrition, and find a platform like Virta that can reverse it with diet. Or in mental health, I just put in here today what's happening, what can you find related to depression. Lots of things already in the database I wasn't aware of, and if you have an innovation that's not there, you can just add it. It's all a free platform, and it's a way for folks to discover and hopefully leverage a lot of these tools in mental health and beyond. So a platform for you to try, and we'll love collaborators on that. Lots of stuff, a lot of things in mental health are already there in that platform. So let me close with how do we synthesize all this? Lots of new data, which is already overwhelming to what we have today. No clinician wants more data. They want the actionable insights. We're in this internet of medical things that will go from 5G to 6G. It's impossible to integrate all these data elements in silos. And what is a doc? Just as I thought, you're generating too much data. No clinician wants the data, they want the insights. So the challenge is to go from all this siloed data, it's often stuck between different EMRs and systems that aren't aligned, and not just to create more data, but more insights, and that information and insights can truly translate to the bedside or the website, narrow that 17-year gap that's so often quoted, so that we can almost have real-time information crowdsourced from thousands or millions of patients, and we can use that as clinicians and close that loop, not just prescribing a digital therapeutic and getting that data, but leveraging it in real time with the just-in-time information. And so that comes to this hopefully new era of crowdsourced healthcare. Just like we couldn't imagine driving without Google Maps or Waze, what if we had a Google Maps or Waze for mental health? Each of us on our journey sharing data that we can use when we're on similar paths and similar traffic at the right time. So if we can encourage each of us and our patients to not just be organ donors or blood donors, but data donors, we can really enter this age and accelerate it as we go, and build that sort of Waze or Google Maps for clinicians and patients to accelerate new knowledge. And there are examples of that today. Obviously, many of us have been doing virtualized clinical trials, a whole new set of opportunities to do that, from platforms like Quantified Citizen to Stuff That Works. Stuff That Works is a really interesting example where you can now see if you have an issue or patients have, they can go in there, and it might be generalized anxiety disorder, and see what's working amongst millions of patients in real time. That should be part of our clinical workflow going forward as well. Finally, how is this going to shift practice of care? Obviously, the pandemic accelerated virtual care. We're going to be more of a hybrid model going forward. In big picture, that's going to take us from our world of intermittent episodic sick care, where we're often reactive, waiting for the heart attack, the stroke, the mental health crisis, or cancer. I'm an oncologist, to evolve to a future that's much more continuous, much more personalized, much more proactive. We can start to bring truly healthcare anytime, anywhere for anyone, and arguably with better outcomes and hopefully lower costs. And of course, bringing care from hospital to home is part of that. A lot of the shift is moving in that interesting hospital to hospital world. And that means, how is our visit going to be different? Obviously, we're in the era of chatbots today, or kind of boring virtual visits on Zoom, we're starting to see platforms like Wobot or Ada or Sensely where the chatbots will know you. They'll know your mental health history, you know your genomics. When you have abdominal pain or a headache or a mood change, it will put that in context and answer and triage you in much smarter ways than these do today. And maybe your clinician will show up as an avatar, right? It's pretty easy now to build personalized avatars that will look like you with your voice or your clinicians. And so if you imagine this mediverse, not the metaverse, but the mediverse, the way we clinically interact can be quite different in this new age. And there's already pretty interesting examples of virtual psychology, which can read expression, voice tonalities, and respond. And these are getting more and more advanced, and I don't think will be more fully integrated into mental health care. And you may have seen the example of Zuckerberg, using the platforms doing this forward. So we can all be turned into avatars today. It's getting easier and easier, and I think that will be part of our future of care. And that begs the question, how do we train medical students and mental health workers of the future? They don't need to just have good bedside manner, but good website manner. And who do you choose to be the clinicians of the future as well? I'll close with this idea of true personalization. Like 3D printing is a good example of making truly personalized braces or hearing aids or medical implants. And I've been thinking about personalization, blending all these new modalities from picking the right drugs and dosing, and how do we make adherence and taking drugs easier, particularly in some mental health disorders. You need a lot of meds, and they're not often appropriately dosed, and they're hard to keep track of and stay adherent on. So I've been developing a little platform called Telemedicine to essentially 3D print your personalized meds, starting with generics, where you could truly integrate all the doses. And you can think about that to change your blood thinner or your neuroleptic, et cetera, and eventually have a way of printing and modifying and printing in your home printer. And that might be a part of the future of mental health and healthcare in general. So I think it's an exciting time to think about this new digitally super connected, intelligent health age. I'd encourage you to think about not any one technology, but how they super converge, and not just where those technologies are today, but where they're going. So it's already a pretty exciting era in 2023, but be like Wayne Gretzky and skate to where the puck is going to be in 2033. And if we have that exponential acceleration mindset, we can move from where we are now, intermittent reactive sick care, to a future that's much more continuous, proactive, intelligence, crowdsourced. And move from our sort of incremental medicine to an exponential age, where we can realize that many of the innovations that have been built here at Stanford and beyond are here but not evenly distributed, and we can take those mindsets and insights and knowledge and need not to predict the future of mental health, but to boldly create it for all of us here on Spaceship Earth. So with that, let's go create the future. Thanks.